So I'll talk about Courvoisier's law. I would like to list down few anatomical landmarks in the biliary system. As we all know, liver produces bile and gallbladder stores bile. Gallbladder stores bile. So the outlet from the liver is through two hepatic duct, right and left, which joins together to form common hepatic. Right and left to form common hepatic. Here you can see the outlet from the gallbladder is through cystic duct. The cystic duct and common hepatic duct joins here at this point to form common bile duct. This common bile duct joins with pancreatic duct. This is the pancreatic duct. Common bile duct joins together here to form ampoule of water. So through this, it enters duodenum. You can see the same in this image as well. The right and left hepatic ducts are from the liver, joins together to form common hepatic duct. And then from the gallbladder you have cystic duct and common hepatic duct here together forms common bile duct, together to form common bile duct. This common bile duct joins with pancreatic duct to form ampoule of water or hepatopancreatic ampulla. To enter the juices from here enters the small intestine. So what does Courvoisier law mean? He says in the presence of jaundice, gallbladder is palpable and non-tender, then the jaundice is unlikely to be due to a stone. So this gentleman in this image is Courvoisier. He's from Switzerland, and at 1980, he proposed these findings. Around 187 cases had CBD obstruction causing obstructive jaundice. Among these 187 cases, among these 187 cases, 87 cases, the cause was due to stone in the CBD called as choledocholithiasis. In 100 cases, the causes were other causes. I'll explain these in a while. So in these 87 patients who had obstructive jaundice and the cause of the obstructive jaundice was due to stone in the CBD, among these 87 patients, 70 patients gallbladder was fibrosed. 70 patients gallbladder was fibrosed and 17 patients gallbladder was normal. 17 patients gallbladder was normal. In these 100 patients, the cause of the obstructive jaundice were due to other causes. I'll explain the causes in a while. Around 92 patients, gallbladder was distended. Very important, was distended. 8 patients, gallbladder was normal. 8 patients, gallbladder was normal. So I'll explain this scenario. This is scenario number 1. You can see this patient has gallstones. This patient has gallstones in the gallbladder. These gallstones over a period of time, makes contact with the wall of the GB, irritates the wall of the GB, to elicit an inflammatory process, Because of this chronic inflammatory process, the wall of the GB gets fibrosed. Gets fibrosed. So as you can see, gallstones makes contact with the wall of the GB that elicits an inflammatory response around the wall of the GB. This chronic inflammatory process leads to fibrosis of the wall of the GB. Because of this fibrosis of the gallbladder, this gallbladder lose the tendency to distend, lose the tendency to distend. Let's say one of the stones enters the biliary system and then gets dislodged in the CBD, gets dislodged in the CBD, causing CBD obstruction, leading to obstructive jaundice, leading to obstructive jaundice. So what this will lead to? Backflow of the bile. This will lead to backflow of the bile to the liver, causing obstructive jaundice and backflow of the bile to the GB. So much of bile gets accumulated in the GB, but this GB cannot distend because of the shrunken or fibrosed wall of the GB. This is what Courvoisier says. This is what Courvoisier says in the scenario number 1. So let's talk about scenario number 2. I told you I'll discuss other causes of CBD obstruction, right? These are the other causes of CBD obstruction causing obstructive jaundice. The first one here is head of pancreas CA. Head of pancreas CA. The lesion in the head of pancreas CA, the lesion in the head of pancreas CA compresses or obstruct the CBD, causing CBD obstruction, ultimately leads to backflow of the bile, and this backflow of the bile, once it reaches the gallbladder distance. In this case, the wall of the GB is normal. Since the wall of the GB is normal, distension happens. In this case, gallbladder becomes palpable. And because of the backflow of the bile entering into the liver, ultimately into the bloodstream, this causes jaundice. Second case is carcinoma of ample of water. Here is the lesion. Same thing happens here. This lesion causes obstruction at the level of CBD, causing backflow of the bile to the liver, producing jaundice, and backflow of the bile to the GB, causing distension of the GB. And the third cause is distal cholangiocarcinoma. Distal cholangiocarcinoma is a carcinoma arising from the epithelial cells of the bile duct. Here you can see this is the lesion. This is the lesion obstructing the CBD, causing backflow of the bile to the liver and to the bloodstream, eventually causing jaundice, backflow of the bile to the GB, causing distension of the GB. And the fourth cause here is bile duct stricture. The stricture here would cause CBD obstruction, leading to the same result. So these were the two scenarios that Courvoisier was talking about. This is scenario number 1. This is scenario number 2. In scenario number 1, CBD obstruction causing obstructive jaundice, and the cause for the CBD obstruction is due to stone in the CBD. In these patients, when gallbladder was examined, the gallbladder was fibrosed or shrunken in size. In scenario number 2, I spoke about other causes like head of pancreas CA, ample of water CA, distal cholangiocarcinoma, bile duct stricture. In these cases, the gallbladder was distended. So these observations led to this summary. But Courvoisier never made this into a law. Later, two people, Terrier and Rob Manson, independently confirmed these observations and findings and made it into a law. This is why somewhere in textbook it appears as Courvoisier's law, and sometimes it appears as Courvoisier's Terrier law. Now I'll talk about the exceptions of this Courvoisier law. The first exception is double impacted stones. In this case, stones are present, but the gallbladder wall is distended. I'm saying it again. In this case, Stones are present, but gallbladder wall is not shrunken, rather it is distended. As you can see, double impacted stone, one stone is at the level of CBD, producing obstructive jaundice like this. Another stone is at the level of Hartmann's pouch. Because of this obstruction, this leads to the distension of the gallbladder and it becomes palpable. So this is your first exception. I'll talk about the second exception, choledochal cyst. Choledochal cyst. Before talking about choledochal cyst, I'll briefly talk about the anatomy here. This is your bile duct. This is your pancreatic duct. Both bile duct and pancreatic duct joins together to form ampulla of water or hepatopancreatic ampulla. This is exactly happening at the level of wall of the duodenum. This is exactly happening at the wall of the duodenum. Wall of the duodenum. You can see clearly here. The point where it opens into the duodenum is your major duodenal papilla. Major duodenal papilla. This is how bile and pancreatic juice enters your small intestine. Enters your small intestine. In this diagram, you can see this is your bile duct, this is your pancreatic duct, this is your wall of duodenum, this is your wall of duodenum. But bile duct and pancreatic duct here joins one level above, one level above. This leads to reflux of pancreatic juice into the bile duct, into the common bile duct. Bile juice and pancreatic juice usually enters like this. And because of this abnormality, pancreatic juice sometimes reflexes up to the CBD, causing destruction of the wall of the CBD. CBD walls gets destroyed, and then loses its shape, gets dilated like this. This is what is exactly happening in case of choledochal cyst, especially type 1 and type 4. I'm not going to talk about choledochal cyst here. But this leads to stasis. This leads to stasis of bile, and then leads to stone formation. Leads to stone formation. It because of the stone formation, it causes obstructive jaundice, and backflow of the bile leads to distended GB, and then it becomes palpable. Becomes palpable. This is the second exception to the law. And then the third exception is your Mirizi syndrome. Mirizi syndrome. Here, the stone is obstructing the outflow of the bile, and this leads to the dilation of the duct above. Because of this dilatation, it compresses the adjacent common hepatic duct. Because of this compression, the bile flow gets redirected, causing obstructive jaundice. And because of the obstruction at this level, this leads to distended gallbladder, and then it becomes palpable. The fourth exception is your parasitic infestation. Parasitic infestation like Ascaris and Clonarchus. You must know CBD stone could be primary or secondary. Secondary meaning the stone was formed in the gallbladder, traveled through your common bile duct, and then gets obstructed at the level of bile duct. This is what I spoke about earlier. Stones formed at GB travels and gets obstructed at the level of common bile duct. In primary common bile duct stone, the stone gets formed at the level of CBD. The stone gets formed at the level of CBD. So here, the stone here the stone gets formed at the level of CBD. And this stone formation is due to parasitic infestation. Parasitic infestation. Imagine because of parasitic infestation at the level of CBD, this leads to bile stasis. This leads to bile stasis. Because of this bile stasis, there is stone formation, and this leads to backflow of the bile to the liver, producing jaundice, and then backflow of the bile to the GB, backflow of the bile to the GB, causing the GB to get distended and then palpable, becomes palpable. So that is all you need to know about Courvoisier's law and the exceptions of Courvoisier's law. Thank you.